Gynecomastia is a presence of excess tissue in a male chest that can create a dissatisfying contour. And that dissatisfaction is usually due to glandular and fatty tissue. So traditionally, gynecomastia is a presence of excess gland that creates that dissatisfaction, and pseudogynecomastia is a presence of fat in the chest, which creates a dissatisfying chest. So I see a lot of men who are bothered by gynecomastia, and I find that most men have a presence of both gland and fatty tissue, and a surgical procedure is directed towards both of those. So liposuction, I think, is a procedure that most men would want to have because it's less of an invasive procedure and an easier recovery. I find that that is a rare male patient that is only going to be treated with liposuction. Traditionally, it's a combination of liposuction and gland excision. So liposuction to the chest, and then an excision of gland and fatty tissue through an incision around the areola. That is a traditional procedure that can take me about 2 hours to do in the operating room, and it's done as a day procedure in my outpatient surgical facility. Now, men who have lost a substantial amount of weight may have excess skin, and that could create a dissatisfaction of their chest. We need to accommodate that in a surgical procedure. So that is typically liposuction, gland excision, and then a skin excision. It is a really great surgery. It's really kind of a chest reconstruction procedure. The downside of that is a more substantial incision, and it's typically an incision around the areola and along the chest wall. And I find that, again, those patients who are really good candidates for that procedure have lost a substantial amount of weight. So gynecomastia procedure is a passion of mine. I really like performing the procedure. My patients are typically quite thrilled with the outcomes, and they feel just better in their body. And I'd really like to meet you and talk to you if you're in the Boston area and you're interested in this. Thanks.